Okay, so I think the flow will be that I'm just going to do a really quick introduction to the project, and then I'm going to hand it off to Mariah to talk about all the amazing services that they offer and some really cool wins and next steps for some of the projects that we have going. So we're here to talk about UCOPE, which is Umatilla County Outreach Prevention and Education. I'll provide the project overview, and then we'll talk about a lot of the impact strengths wins from the last couple of years on this project, and then the next steps. So for UCOPE, the mission for the project is to develop a collaborative team of partners in Umatilla County, including the perspectives and voices of people who use drugs, to coordinate and implement a package of interventions using a harm reduction framework to improve healthcare access and outcomes for people who use drugs in Umatilla. And we want to support the whole health and well-being of people who use drugs across the recovery continuum. That's including through increased access to preventative and collaborative care, testing and treatment for hepatitis C and HIV, harm reduction services, immunization, and cross-sector collaboration and increased availability of provider and community education about substance use and substance use disorders. And we're in our fourth year of this project, I want to say, going into it. So we've been doing this for a little bit and we've had some really cool things happen. This is a CDC funded project. Our local partner is COPES. Mariah is going to speak about all the cool things that are happening at COPES. And then we also have support from OHA. And I work with CoMagine to do some data collection and evaluation of this project. So here's our desired outcomes. I already spoke about them a little bit in the vision for the project. So part of what CoMagine does is evaluate what UCOPE is doing, and we did a really fun evaluation exercise this past spring, looking back at the previous years of this project. It's called ripple effect mapping, and it's really meant to highlight all of UCOPE's impacts using the team's knowledge, stories, and experiences, and also to increase understanding of the program's influence. So capture some of the cool things that have been happening in Umatilla County, encourage planning for the future, and to share a narrative of change and success, which Umatilla has seen a lot of over the past couple of years. This is like one of the little boards that folks put together. So people were able to participate by answering questions. We had a facilitated discussion where people could talk about all the impacts, successes, strengths, challenges, and future goals of the UCOPE project. So I grouped it into kind of three things that are being implemented in Umatilla. So outreach, the mobile service trailer, which is something that this project has been supporting, and then also the peer centers. So I'm going to hand it off to Mariah to talk about all the things they're doing and some of these impacts and strengths.
Thank you, Danielle. So some of the impacts with outreach is previously and also kind of now we're in the slow season now for outreach. Unfortunately, it's cold. But we were we do conduct a lot of like outreach into the camps and stuff. We really were trying to get the trailer out into the camps to help provide like wound care and Hep C testing, all that to like the people that are out staying down by the river and things like that. And so a lot of the stuff we do is we hand out like a lot of Narcan. We also did a big event during Roundup. And so it was actually, we were asked by the city manager about doing it again this year. So we did it last year. And the outcome is really cool because we have the trailer down there. And we actually this year had a bunch of community partners come down and join us, which was like super amazing because that's one of my most favorite things when we do outreach is to collaborate with other people because the only way you're really going to deal with the problems is if we come together. And so it was really amazing. We did hot dogs and we actually had somebody come down and do free haircuts for our clients. And we had volleyball and it was a lot of fun. And so, and then we also kind of do a thing where it's like, it's called Unity Within the Community. And so we plan a lot of outreaches together as well based on like, we do like quarterly events. And so we kind of like pick like a goal or like a commitment to each event. And so we did a lot of events where it's like 36 different organizations come together and we kind of work together to provide like this space for people to realize that we're one unit trying to provide the same service, which is just helping the client with what they need. We also did like an Earth Day to kind of help clean up around like like the levee and things like that, because the garbage around the levees and stuff was kind of becoming a problem. And so we just wanted to help try to like start the initiative of just like giving back to the community. So then some of our strengths. So there's nothing short of the passion that we have for what we do. My peers are super comfortable with outreach and they absolutely love it. It is something we hold very close to our hearts. And then, like I said, we have gotten a lot better at collaborating with a lot of other organizations. We've been planning a lot of outreaches and stuff like that together. So we have been building like a lot stronger community relationships. And advocacy has improved. So we actually have a really good working relationship now with the hospitals and the jail because of our consistency of advocating for our clients of the need of having peer services and like all of that stuff within the jails and stuff like that. So mobile trailer. I'm really excited about this because we're actually doing some great things. Go ahead and go to the impact. So some of the impacts is one of the cool. So I don't know if you don't know Pendleton or not, but everything's located on one side of the town, like all our medical services, and it's on like the biggest hill in town, like the biggest hill. And so it's really hard to get to. And so being able to provide that low barrier access to medical services to our clients who are houseless because everywhere they sleep is on the other side of town. And so that's been a big barrier that we overcame. And then also since then we've had the mobile trailer. We've actually had other organizations reach out to us about bringing our mobile trailer over. Like, hey, can you bring your mobile trailer to this event? It's very focused on providing services of, like treatment or like testing and things like that. And so that's been really awesome. And then I think the most amazing and valued thing about it is it's a very trauma-informed care that they get from the trailer. And so everybody on there either has trauma-informed care training or they are somebody with their own lived experience. And so sometimes walking into a hospital or a doctor can be very intimidating for our clientele and almost like they get a lot of guilt and shame. And so the ability to walk into somewhere knowing that you're going to be accepted and welcomed and that, they've even been through stuff like this, like it's very helpful with getting our clients connected and wanting to engage with us. So kind of like what I mentioned that the clients that are getting judgment-free medical services, we actually do have clients who are taking we have one client who struggled for a long time with going to his wound care appointments. And so finally it's like a regular thing they do now and they actually go and it's helped out immensely. We were really scared for him for a while. And so it's just like, but it was that consistency from us in the trailer of always being there and just kind of like saying like, hey, like you got to do this, you got to take care of yourself. And so just having like that positive environment and like encouraging them and, about their healthcare needs and meeting those is really important. So, and we, there's more visibility for COPE's partners and are seeking questions about services. So we do have community partners who reach out to us for especially Hep C services. So we're one of the only places that provide because we work through the PADS program. And so we're able to do rapid Hep C testing within our trailer because all of our peers are trained and we get them treated through OHSU, through their program, through PADS. And so we're one of the only places that provide Hep C treatment in our area. So that's pretty exciting. I'm pretty excited about that. So, man. The centers. Okay. So the impacts of the centers is, thing about the drop-in centers is that they're very unique. I don't really know how else to put it. They're super unique. The services that we provide it's not like a lot of other peer services that you would see. We very much target like the contemplation stages of change. So people who are not just really aren't ready to get clean, but that's okay. Like I think that we're super harm reduction focused. We meet people where they're at. We are super culturally like specific. Like almost every center has access to Spanish speaking peers. We also have like hopefully in the future we're hoping to get a Spanish center, but yeah, and then we also we just had our grand opening for the youth peer center, which is amazing. It's actually good. They've had kids every night since. And so they're actually getting ready to do a chocolate fondue, like Christmas party thing for the kids. And so it's just kind of cool. I just grew up, born and raised here. They used to have projects like that. And so to know that it's bringing things back like that, because the youth really are underserved in a lot of rural areas. So, yeah. So then in law enforcement they're coming around to us. That one's been it's been a little rocky. And I think a lot of it comes down to the stigma around addicts, right? And not even just on the addict side, but also like the addict with police. And so that's really like, we're not just trying to help serve the addict. Like we serve the addict, but we also are trying to help break down that barrier between police and addicts, because in reality, they're just trying to do their job. And a lot of them actually do care. And then like the addicts are like, that's just the way our mentality is, like, oh, police are bad. And so we really are just trying to bring the community together with the breaking down the stigma and stuff like that. So the law enforcement have asked more about like our centers and what we do, and been intrigued to even listen to my own, like a lot of our peers like stories and stuff. And so yes, and then so before we were offering, like we had wound care, but I mean people are skeptical. And so yeah, so now we had kits that we would hand out until people were like, hey, like no, I'll just take some kit and I'll fix it myself. And so now like they are very much more open to doing wound care services with us, because we built that rapport. So yeah, so since then, yeah, we definitely, wound care is something that we provide a lot more out of our centers and stuff as well. So um so yeah, so we actually have a couple clients who are successful through our program. And he actually, it's exciting because he comes to our center every day to share a lot of his story and what he's been through our programs. And we have other clients who are like, yeah, I've been coming to COPES for this long, and this is where I've gotten. That same client just got his CRM. So I'm like super pumped, because I'm like, there's nothing more powerful than a peer in their story. Like I can't even express how powerful a peer story is. It is probably like a superpower of superpowers. And that's one thing I always try to tell my peers. I'm like, your story is something nobody can ever take away, and it is so powerful. And so yeah, to see our clients go from like the bottom to reaching almost like their top, and then just see them keep going, like that's a huge, like I love it. And then we get all the time, I should have gotten some of those the surveys we have from, because we do a survey every year now about like our barriers and impacts and stuff in the community with like peer services and COPES and UCOPE and all that. And all the positive things they say about our peers and stuff like that, and that they feel like so supported and welcomed. And yeah, it's seriously heartwarming. And then of course, there's a huge passion for harm reduction. Like I said before, we are a harm reduction program. I'm probably my passion for harm reduction is like probably overly passionate, maybe almost aggressive. I don't know, but that's questionable. No, I know it works. I've seen it work. It's evidence-based, like it works, right? And so we have a huge passion for harm reduction and just meeting people's needs, because every human deserves the right to have their basic needs met. Like I don't care where you are at in life. Like you deserve that. You deserve a shower. You deserve a hot meal. You deserve a warm bed. Like there's no reason why you shouldn't, no matter what you're doing. So yeah, so it's definitely a strength. And then Yeah, and then we provide, of course, we have peers who've been through their own lived experience of treatment or prison or whatever their recovery path may have been, and so we're there to help people until they are ready to go. That's the whole point of like harm reduction, right? It's like, I'm going to love you until you can love yourself. I'm going to be here. And then when you are ready to go, guess what? I'm already ready to go too. So let's do this then, And so, like, just having that walking by their side until they're just ready to take that leap, it's definitely huge in the centers. And then, yeah, and then the diversity among the staff, again, when it comes down to the diversity of like everybody's story, everybody's different, everybody has something different to bring. So yeah, it's a beautiful thing. So, oh, future steps. Um, yes. So we definitely are going to have more partners getting involved, and then the yes. So one of the things that we've faced is like getting peers into places to where they need to be. Like into certain parts of the schools or jails or things like that. And it's like, I think just having a lot of, I think that just lack of education of what a peer is, what really is a peer, right? Like, what does that look like? Like, yeah, we have a record, but that doesn't define who we are now, And so having those conversations about what peer work is and what we can do. And then hopefully expanding in Melton, Freewater, and Hermiston, being able to provide more services of what we offer here in Pendleton. They're like outpatient and Medicaid assisted treatment and things like that. And then, yeah, and then hopefully just expanding to city manager or anybody in higher in authority to expanding harm reduction services in our community, whether we Narcan machines all over town, which of course I would love, but anything. So
I feel like that's probably close to time, and it gives a really good snapshot of the stuff that is happening. So I'll just re-emphasize some of what Mariah already pointed out, but that in terms of the mobile services, the peer drop-ins, and all the outreach that Copes is so good at making people feel welcome. And I think we've just seen over the last couple of years a real shift in how people are, instead of nervous about receiving care, are willing to go and receive care from the services that Copes is giving. So that's amazing.